So after 4 years of medical school and another 4 years of training specifically in women's health, I became a general OB-GYN physician. I was a great obstetrician. I was a really, really good gynecologist, but I have to be honest with you, I was a terrible menopause provider.
Hi, I'm Dr. Gila Senamar, board certified OB-GYN, but I wasn't a great menopause specialist at all, not to my patients, not for myself. So when I went through the change a few years ago, I had to run around, learn about everything myself so I could self-treat.
I didn't receive any training for it. In my master's degree or my PhD, I didn't have a class on it. And I didn't even have it mentioned. It was never mentioned. Even in the lifespan classes that we talked about in human development, we never talked about mental health and perimenopause and menopause. Not once.
Okay, I'm jumping in. My name is Dr. Carrie Panoff, and I was a terrible menopause doctor. That's it. I said it. Well, I worked so hard to be there for my patients and community, I sucked at treating their menopause. And it's not that I didn't want to address the not so random symptoms that my patients were reporting. It's that quite honestly, I didn't know how. This is no joke. There's got to be something more than this. So I started to dig, and only through outside continuing medical education, tapping into friends and colleagues, and reading, lots of reading, did I begin to have the confidence to treat.
I was a terrible menopause doctor. Why? Because I got zero training in my OB-GYN residency or in medical school on how to manage menopausal symptoms and what menopause actually was. It's only when we get humble as doctors and become intellectually curious about the gaps in our medical education that we truly can meet our full potential at serving our patients.
I'm joining the other menopause providers to say why I used to be a terrible menopause provider. I'm a board certified endocrinologist, and I am now a specialized menopause provider with Menopause Society. But not too long ago, I really didn't know anything about menopause. Even though I keep up with all my continuing medical education, I read journals vigorously, it wasn't until I myself became perimenopausal and also noticed with increasing frequency the patients that I was seeing with complaints similar to mine that I started really delving myself into the research about menopause, and my mind was opened and kind of blown about all of the great research and opportunities and treatments that I then started using myself.
Jumping on the bandwagon with some of my clinical besties, Dr. Mary Claire and Dr. Corinne Men. Just wanted to talk about my training. Yes, I was a terrible midlife provider. And part of why is because I didn't get the training in nurse practitioner school, nor did a lot of my colleagues that are NPs, MDs, PAs, midwives. And part of it is because I was a product of the Women's Health Initiative.
And I was trained in primary care. We take care of humans from birth until end of life. We take care of anything and everything that our patients want us to take care of. And I had wonderful training in my residency for women's health. I had zero. I started with medical school in 2002. I took 2 years off with my oldest daughter. I got nothing in medical school. And in residency, although it was very, very wonderful in women's health, I did not get any training in how to take care of the perimenopause and menopause patients.
Of course, I was a terrible menopause doctor. And how could I be a good one when the Endocrine Society latest guidelines for menopause treatment are from 2015? Frankly, we become good menopause doctors when many of us experience the symptoms of perimenopause or menopause, and when we start really listening our patients and seeing the effects of their hormone replacement therapy.
And like so many of the other menopause specialists, I too received no menopause education in my PA school. And when I started working as a gynecologic oncology PA, menopause just wasn't on my radar, wasn't something I was thinking about, and I was kind of shocked to find that my patients' most bothersome treatment-related side effects from their cancer treatments were often menopausal symptoms. And so right away, I knew that it was a problem that I wasn't able to deliver the care, that I didn't know enough about menopause management, specifically for cancer survivors. And I also, noticed right away and felt right away the fear around hormone therapy and just the lack of education in the oncology world surrounding menopause care.
All right, I'm jumping on this too with my friends Dr. Men and Dr. Mary Claire Haver to tell you I was once a terrible menopause clinician. Yep, you heard it right. I was terrible. Why? Because just like so many of my colleagues, I got next to no education about menopause and hormone therapy. And what I did get was stay away from it with a 10-foot pole. Do not prescribe hormones for this, or you will give your patients cancer, breast cancer, and these are all normal parts of the aging process. And the symptoms will go away and the women will be fine on the other side. Very little education about the symptom profile, the health sequelae, beyond bone health. So yes, I was. And in 2017, I took a leap of faith and started working under an amazing gynecologist who worked with women for menopause and hormones, and voila, the rest is history.
And as painful as this is for me to come on here to admit, it's much more painful for you as a patient. Let me be clear. Menopause is so much more than the end of your periods, the end of reproduction, and a few bothersome hot flashes.
We're not done once menopause hits. We've just begun. So let's do this together.